Perinatal Perspectives is actually an event that was planned as a result of a larger project that Shared Care is doing in the Comox Valley called Enhancing Perinatal Care in the Comox Valley. And about 2 years ago, a group of us got together and developed a steering committee and an advisory team to look at how we can enhance collaborative practice in the Comox Valley around perinatal care. And actually ended up with about 4 key strategies that we've been working on for about 2 years. One of them has to do with standardized care, one has to do with care provider collaboration, one has to do with equal access to care for patients, and then one has to do with care provider and patient knowledge and information. So we have working groups that are built to address those strategies. But one of the overarching themes of the entire project was how do we really address vulnerable populations? Vulnerable populations need standardized care. Vulnerable populations need equal access to care. Vulnerable populations need better access to information. And we also felt that each working group wasn't really addressing the needs of the vulnerable population. So we developed a working committee that created the notion of having a large-scale event where we could bring key stakeholders together across all care provider groups to talk about how we can better address vulnerable populations, hence Perinatal Perspectives, maternity care through the lens of the vulnerable patient. And so this event this evening has been a culmination of 2 years worth of work where care providers can collaborate, can create opportunities for dialogue, to build relationship, to increase access for care, to provide information to one another, ultimately to enhance patient outcomes. We started by approaching Chief Dr. Robert Joseph, who came and talked with us about reconciliation through the eyes of healthcare practitioners.
When we reconcile, we will know that high quality health will be available to all people. When we reconcile, education will belong to everybody. No one will be left behind when we reconcile. When I was a little boy, 6 years old, I ended up in an Indian residential school. And I didn't realize how destructive that would be for me. I simply went through that process 11 years, and I thought that all I had become, no hope in my life, no values, no purpose, no sense of worth. I thought that was just normal for an Aboriginal person. By the early age, I was developing anger and rage inside. I couldn't understand me. I always wanted to be good. I always wanted to be loved, to be acknowledged, to be cared for, to be caressed. And somebody saying, "You're important." And I just didn't know how. We need each other to move this country forward in a way that we have never done before. Holding each other up, embracing each other, loving one another. At the heart of reconciliation is a whole idea that we can begin to love ourselves and then to love others. And there's nothing more powerful and binding than beginning to hear each other. We begin to recognize our common humanity, and we begin to see things differently. That indeed we are Nummayut, we are one. We're all in this together.
As a family doctor, in my practice, I tend to work with a lot of vulnerable patients, 60% of the time in the hospital, 40% of the time in various clinics, and my focus is on vulnerable patients most of the time. I think today the key message there was reflecting on that idea of reconciliation.
Then we had Dawn Wilson come, who is a practicing obstetrician from Calgary, talk about vulnerability and resiliency.
When I was making this presentation, I had to keep in mind that it's a very diverse group of people that are here. And that's exactly the type of audience that we need to be addressing to approach this problem of social vulnerability. From my perspective, I think my approach usually is to make that extra effort to identify some of these patients that have vulnerabilities that might not be obvious when they first show up in your office. So Sometimes it requires digging a little deeper than the problem with which they present to the healthcare provider. So I gave the example in my talk earlier about a patient who came with a very simple clinical problem, but as I delved in a little deeper to her social history, I discovered that she was bereaved with the loss of her son. And she was not going to bring that information forward at the beginning. So this is a patient who's going through a horrible loss in her life and of course very vulnerable as a result.
The real key piece is the relationship of really being with people, being present, listening to their story, what their life experiences has shown them, and how they might create meaning from that life for their hopes and dreams for the baby and for the future of their family together. So really the key piece is being in relationship. That's the intervention.
We also had a phenomenal presentation from a nursing perspective around a mother's story, which is an approach to relational practice that Island Health is currently implementing on Vancouver Island.
So most public health nurses working up until just recently, including myself, were not educated or trained to practice in a relational way. I spoke to Dawn Wilson just a few minutes ago, and we were trained together as nurses in 1993, and this wasn't part of our education, was it, Dawn? There's lots of others, more elder nurses than I also, that can relate to that. We were educated to be the expert, that we had knowledge to offer to people. We would do risk assessments and see where people were determined where their degree of vulnerability was. And now, through the opportunity of the principles of Mother's Story, we are shifting to a new best way. We are taking the learnings that are happening in our current colleges, not only in nursing, but I believe in medicine and in social work and in other disciplines, and looking at the people, or in this case, as we talk about perinatal, the women as the experts in their lives. And we look at the context of the women's life and the strengths that she has to adapt to those, to that context. We're learning the principles of the Mother's Story, which are the relational practice, the reflective practice, cultural safe practice, and the trauma-informed practice in a real strength-based approach. So many nurses have not been educated in this way, so we're doing a lot of learning. We're learning from the stories of how the Mother's Story was rolled out in New Chelmsford and how it worked with women there. And we're approaching women in a different way.
The Perinatal Perspectives event is culminating in action items that participants are taking away with them to implement in their practices every day. Our participants include a cross-section of stakeholders, from physicians to midwives to obstetricians to mental health, public health, ministry individuals, doulas, school district folks who are going to work with patients in a different way as a result of this event.